Welcome to Middle Class Matters, Business News in English from Dr CMA Alagesan. Let's say today, Pradhan Mantri Jan Arogya Yojana PMJAY 1.1 Chapter 1 Overview 1.1 Introduction. Ayushman Bharat is a health scheme of the Government of India launched on 23rd September 2018 to achieve universal health coverage as recommended in the National Health Policy 2017, which envisages the attainment of the highest possible level of health and well-being for all at all ages. The scheme has been rolled out in rural and urban areas based on the deprivation and occupational criteria of the socio-economic caste census 2011, SCCC 2011, respectively, for over 10.74 crore families. Aim of the scheme is reduction in out-of-pocket expenditure of poor and vulnerable population. Ayushman Bharat comprises of two interrelated components, which are 1. Health and Wellness Centers HWCs. First component of Ayushman Bharat is the creation of Health and Wellness Centers HWCs by transforming primary health centers PHCs, sub-centers SCs to provide comprehensive primary health care CPHC. HWCs will enable a focus on wellness and health promotion, provide an expanded range of primary health care services, including access to medicines and diagnostics to be delivered close to the community. The objective is to set up 1,50,000 HWCs by December 2022 in order to facilitate universal health coverage and reduce out-of-pocket expenditure. As on November 30, 2022, 1,31,151 HWCs were functional. 2. Pradhan Mantri Jan Arogya Yojana PMJAY. The second component of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana PMJAY provides a health cover up to Rs 5 lakh per family per year for secondary and tertiary care hospitalization services. PMJAY provides cashless and paperless access to services for the beneficiaries at the point of service. The inclusion of households is based on the deprivation and occupational criteria of the socio-economic caste census 2011 SCCC 2011 for rural and urban areas respectively. This number also includes families that were covered in the Rashtriya Swasthya Bima Yojana RSBY but did not form part of the SCCC 2011 database. Even though PMJAY uses the SCCC as the basis of eligibility of households, many states are already implementing their own health insurance schemes. The states have been provided the flexibility to use their own database for PMJAY. However, they have to ensure that all eligible families based on the SCCC database are necessarily covered. Beneficiary eligibility for PMJAY is detailed in Annexure 1.1. This report examines various issues relating to the implementation of Pradhan Mantri Jan Arogya Yojana component of Ayushman Bharat. 1.2 Subsuming RSBY in PMJAY. A committee of secretaries constituted for transition of Rashtriya Swasthya Bima Yojana RSBY from the Ministry of Labour and Employment to the Ministry of Health and Family Welfare had submitted in December 2014 its report to the Cabinet Secretary and cited multiple weaknesses in implementation of RSBY such as inadequate involvement of state governments, lack of uniformity in database, no indicators for monitoring of scheme, lack of awareness about the scheme, among intended beneficiaries, non-enrollment of significant targeted population under this scheme, and increase in out-of-pocket health expenditure of beneficiaries, etc. To integrate RSBY into the health system and make it a part of the comprehensive healthcare vision of Government of India, RSBY was transferred to Ministry of Health and Family Welfare Ministry on as its were basis with effect from 1st April 2015. Keeping in view the shortcomings of RSBY, Cabinet approved March 2018 the launch of Ayushman Bharat National Health Protection Mission, now known as Ayushman Bharat Pradhan Mantri Jan Arogya Yojana PMJAY. PMJAY was launched on 23rd September 2018 across the country. 1.3 Salient features of PMJAY. The salient features of PMJAY are: 1. Health cover of up to Rs 5 lakh per family per year on family floater basis for secondary and tertiary care hospitalization through a network of public and empaneled private healthcare providers. Cashless and paperless treatment for the beneficiary at the time of hospital admission. No money is required. 3. No cap on family size, age, or gender. Dependents of the registered beneficiary can avail benefits on his or her card for coverage of 3 days of pre-hospitalization and 15 days of post-hospitalization expenses, including medicines, follow-up consultation, and diagnostic. 5. Benefits are portable across the country. A beneficiary can avail PMJAY benefits in empaneled hospitals from any state beyond his or her home state. 6. Inclusion of 1393 procedures in Health Benefit Package 1.0 HPBP 2.0 released in December 2019 presently covers 1949 procedures with 27 specialties. April 2022. 8. Treatment of COVID 2019 patients had also been covered under Ayushman Bharat with effect from 4th April 2020. 1.4 Institutional structure. The Union Cabinet on 21st March 2018 approved the Ayushman Bharat National Health Protection Mission, and the National Health Agency was set up as a society under the Societies Registration Act 1860 on 23rd May 2018. In September 2018, the mission was renamed as Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. On 2nd January 2019, the Union Cabinet approved the restructuring of the National Health Agency as the National Health Authority (NHA) as an autonomous body under Ministry of Health and Family Welfare. With this restructuring, the National Health Agency, which functioned as a registered society, was dissolved and its status was enhanced to that of an authority. NHA has been provided with full autonomy, accountability, and mandate to implement PMJAY through an efficient, effective, and transparent decision-making process. NHA is governed by a governing body. It is chaired by the Union Health Minister for Health and Family Welfare and as a panel of 11 members. Organizational structure of NHA is given in Annexure 1.2. Institutional structure. National Health Authority (NHA). NHA, headed by CEO, is divided into 7 verticals, namely Finance, Administration, Policy and Knowledge Management, Information and Technology, Beneficiary Empowerment, Hospital Networking and Quality Assurance (HNQA), and State Partnerships. These cover the operations and support functions in the implementation of PMJAY. State Health Authority (SHA). State Health Authority SHA is a nodal agency responsible for implementation of PMJAY in the states, headed by the Chief Executive Officer CEO. The CEO SHA is appointed by the state government and is ex officio member secretary of the governing council of the SHA. The CEO is supported by a team of specialists dealing with specific functions. The team is counseled and overseen by a governing council set up by a state level. Along with the day-to-day operations of PMJAY in the state, SHA is responsible for data sharing, verification and validation of family members' information, education, communication and monitoring of the scheme. District Implementation Unit DIU. District Implementation Unit DIU, chaired by DC, DM, Collector of the district, has been established to support implementation in every district included under the scheme. The DIU coordinates with the implementing support agency, ISA or insurer and network hospitals to ensure effective implementation and send periodic review reports. This is on the PMJAY scheme, which is also under the CAG audit, which has brought in so many irregularities in this scheme. Please like the video, subscribe to the channel, share to your friends for disseminating the knowledge among the public. Thank you for watching.